I'm not a biologist by training, but I've grown to appreciate just how complex biology is and also how little we understand how these diseases even occur. Understanding that requires the deep scientific background and then also the deep technological innovation in AI to figure out how to meld those two worlds together. I grew up in a military family. Both of my parents actually served in the military and the Navy. My dad had an engineering background. My mom had been a Navy nurse. So when I was little, I was actually really big into art and music. I was kind of like the creative wild child. But my dad, having this like engineering and computer background, we would have like 4 different computers in the house. I used to play this game on the PC called Creatures, which basically what you were doing was training a neural net. And at the time, I just thought I was super into gaming. I went online, I talked to these like adults basically, and I was like, how do I run this with evolution? So they taught me command line interface things so I could like run this very fast and evolve my creatures at night. So I would take over the computer, do all of this type of work. And so I kind of look back and I'm like, okay, I thought I would be in art and music, but it should have maybe been obvious that I would have ended up in something very scientific. I was basically doing like cloning and trying to evolve these creatures and training neural nets. All of these things were giving me strong signals of like, you have capability of going in this direction, but I didn't really pick up on it. Given my background, like military family, super religious, and me being female, I was in this very conservative culture where the messaging towards daughters was very much like for me to become a stay-at-home mom eventually. But I kept having some wins, like I got large scholarships through SAT and whatnot. And then while I was at the university, I kind of discovered like these are actually my people. So when I went on to my PhD, I decided to focus on biophysics, go more in that theoretical direction. I was doing very heavy physics-based simulation work in my PhD, and at that point in time, we had a few new faces to the department who were really like forefathers of trying to integrate AI into physics-based modeling. One of those people is Pratush Tiwari that we're now collaborating with and actually doing a research study with at Sandbox. So now I'm the head of simulation and biologics, so it's one of my heavy focuses to push the biologics. So biologics, you could think of it as a class of therapeutic or diagnostic tools where essentially what we're trying to do is just learn from biology. So antibodies, for example, that's a tool that your immune system evolves to attack invaders like viruses. And what scientists have tried to do is instead of creating completely new tools, learn from what's already been created over many millennia of evolution, and then say, how can we use that to accomplish these things that we're interested in? Part of my role is to come up with new, innovative strategies to solve problems that we think will be impactful for client projects, and that would be things like developing new drugs or developing new antibody therapeutics. So for example, you could develop a biologic, which would be an antibody, and then use it to try to detect a protein that could indicate that someone has Alzheimer's. But we could also use biologics as something like a therapeutic or a vaccine. So for example, the COVID vaccine, that would be a type of biologic where you're injecting an RNA, which gives instructions to your body on how to produce something, and then your body responds and mounts an immune response. But we could also have biologics where it's a medication, essentially. So it's something that you put into a patient that could be injected through a serum, and then it can treat disease as well. So our biologics platform is both AI and physics-based simulations. And one of the ways that simulations is really powerful for biologics is that we have a lot of large pharma companies where they're developing antibodies for therapeutics, and they're actually really advanced when it comes to AI because these companies sit on a wealth of data. But they end up having new projects where the AI models that they currently have in existence aren't able to address the types of questions that they're interested in. And they also might not have enough money available to run a bunch of experiments to refine their AI models. Physics-based simulations can be a lot cheaper. So basically, instead of going and doing all of these clones of the proteins and purifying them and getting enough volume and then running the experiments, we're able to run the experiment essentially like in a computer. And our experiments that we run per protein will be something like 70 cents to do an affinity prediction, which is a lot cheaper than doing the experimental data collection. Some of the areas that we're really focused on are neurodegenerative diseases, such as Parkinson's. And then an area that I'm really excited about is our work on new types of biologic therapeutics that will treat glioblastomas or brain cancer. I think the technology that we're developing, if we can get that into the hands of more people, that has a huge impact for medical outcomes, which is what I'm ultimately really trying to do with my work. I'm Mary Pitman, and I work at SandboxAQ, and I invent new ways of integrating AI and physics-based simulations so that one day in the future, our technology can create new therapeutics to treat diseases that currently have no treatment.